Hi, welcome. I'm going to introduce you to some of the procedures we have for the clinic. This is Dr. Gupta, and we enjoy having students. We're just giving you a little guidance with how to put all the pieces together. I'm going to show you message tips because the patient communications are critical in a clinic. So you often are thrown in to being allowed to assist with the phone. So that's the first place you want to make sure you know how to proceed. Then I'm going to show you a couple of our systems that we're currently using so that it'll make a little more sense. You can keep these tips and then hopefully it'll be very useful if you look back at this overview a couple of times as you get more familiar. Let's start with the message slip. So in the clinic, there's a couple things that you want to keep in mind when you're helping to take messages. We talk about the message slip big picture ideas. First of all, always, if possible, pull the chart with the message slip. The safest way to make sure we're not making a mistake is to have the chart. If we don't have the actual chart, the best would be to have the electronic chart or to pull up their information in a system called Relay, which has electronic scripts. When you take a message, it's very important you put your name at the bottom of the message slip, because when we have a message and we have a question, then we know who to follow up with. Putting a date on a message slip is critical. As one of the people who taught here, Alex, used to tell us, something as small as the date is a big detail. For example, if we miss a date on a message slip, it could be found later in the week, and then we have no idea when the message was received. For example, a patient calls because they need surgical clearance for their surgery on May 5th. If the date is missing, we do not know. Was the message addressed? Is it past the surgery date? How long ago was the message taken? When the patient's phone number is missing, we have the message with the pharmacy, date of birth, date of the message, but when the patient's phone number is missing, it can make us have a delay. For example, if you don't have the patient phone number, there is a mix-up in the medication listed in the request versus what's in the chart, so we cannot confirm which one was correct. The best thing also is not to just write the phone number from the caller ID, but always ask the patient on the phone, what is the best number to reach them back? Always make sure then when you take a message that you are keeping track that that message got addressed. Cannot take a message and then forget to get back to it. If you're not sure that you're going to be able to take care of the message because it's getting busy, you need to pass it to a front desk regular staff like Deb or someone who's handling refills that day, such as Greg. Now, talking about the systems that we use, we have a scheduling system that you'll see every day, and it's called Advanced MD. This is what the window will look like once you sign in. In order to sign in, you're going to see this window before clinic starts, and you'll see the username, which someone will help you sign in, and then password and the office key. The office key is 112673. They'll be able to help you with that. And then we click on this box in order to log in. The weird thing about this screen is you actually are using lowercase, but what is shown on the screen as you type is uppercase. For example, I'm typing lowercase here, but it's coming in as uppercase. Once you sign in, then you'll be taken to the main screen, and this is what we call the live schedule. This is the most accurate, up-to-date information. This is the same system that does the billing. So a couple of things that we can find here. This is to go to a patient screen. When I click here, you'll see it opens up a patient window. I can type in a few letters of the patient's name. Which I'm going to close here because we're going to be posting this. So, but that's how I can get to the patient. Then I can get to the schedule by hitting this calendar. This shows me who is scheduled. These are patients that we're seeing, and these are nurse patients that we're seeing. I can bring up a patient by going in here, typing a few letters of their name. It'll bring up, if there's a note, it'll bring up their phone number, and it'll allow me to use this patient. So this patient, if you need to be put in the schedule, which you would do after you're supervised. But for example, we can left click, hit make appointment. Now his name is popped up for an appointment. The most common appointment is the established visit appointment. And we always put comments. What questions do they have? Refills? Is there a particular result that they need? I'm going to cancel this because that was just for an example. So again, this takes you to an individual patient's detail. This one takes you to the schedule. Now when you're in the schedule, there's a few different things you can do. Most of them are from left click. Left click will give you these options. You'll be able to change their appointment. You'll be able to check them in, check them out, and if they need to cancel or no-show. This one right here will let you print a billing slip. This one here, move, allows you to move the appointment, and then of course delete. So if someone says, I need a charge slip, you come here, charge slip, and it'll ask you this, and then when you hit generate, it will generate a billing slip. Another useful thing that we often need is the schedule. Scheduled is under reports. You go to appointments, column appointments, and then you would choose if you need today's schedule, tomorrow's schedule. You hit generate, and here's your schedule. When you hit print, you will see that there's a variety of printers. The ones that we use up front predominantly are either the 7860, which is the black printer on the right. Let me see if the other one is here. Not seen in this list. There's also a second printer that will say front desk printer, and it'll say Deb. Those are the two printers we use the most commonly up front. So again, to get the schedule, we go to reports, appointments, and then column appointments. So bringing up a patient to quickly see their phone number or their date of birth, looking at the day's schedules or what's available, say next week, for example. If I'm on a patient, I was wondering when did they last come, I can actually quickly click on that and I can see the previous appointments. This one's a future appointment. These are completed appointments. Let's say you need information on the patient. Again, you can open a patient window, and I'm going to use, this is not a real patient, but I can show you it. Okay, this patient is a pretend patient. So when I open this wider, you'll see I have an appointment window and I have a patient window. On this patient window, you have the different tabs. the tabs you'll have, sorry, screen is on the wrong spot, but you'll have a patient tab, an insurance tab, which would show you which insurances, 1, 2, or 3 insurances. You can click on the different ones to see which one is primary. There may be notes about that when they first set up that insurance. There's appointments, shows their appointment history. History is where you'll actually see what was billed. This one doesn't have any because it's not a real patient, but this is where you could click on, could double click to see what was the status. You can see if the patient, what was paid, PI for insurance payment, PP for a patient payment, what balances remain. You also can change to all items and hit reload to see previous items. Normally it starts on open items so that you can see what's still pending. This is very useful if you're trying to learn about billing, to look and see for patients who have high balances what's going on in the history. They'll often have notes that will have details of problems that have occurred as well. And these are the main things that you're going to use in advanced. Now, we also have several places we like to get information from. If someone asks you to help, for example, obtain lab results, that tab will look like this. This is the login screen for Oakwood Labs, and the labs are needed for patients who are coming in today. We usually will pull up their recent 2 months of labs, and we're under account number 1070. They'll go over username and password that we need. Once we log in, then your screen will look like this. All you have to do is go to the new patient, type in the last name, and they will actually pop up more than one time. Sometimes the same patient will have 4 different items pop up, so you just open it to figure out which is the recent one. You see here, this is a 2009. So that's not the correct one. And I look here, okay, 2014. And I look down, this is probably the most recent one. So he has not had a lab since 2014. This shows you what labs he's had, but this is where you would actually hit to see the result. So this is the screen you go to get labs. We'll also often need results, and most of our results are in an electronic fax. Our faxes do not come on paper, they come through a system. The system is called Updox. And it looks like this. We go through, these come in unlabeled, and then we have to do a series of labeling. So when you need to find that's how we obtain the lab results. Then we have other results that are in the electronic fax called Updox. It has an inbox. It also has a place where you can decide what you want to look at. This inbox is taking a while to load. I can filter and say I want to see only prescriptions that are due. I can say I only want to see record releases. And then I can see what's remaining, what needs to be done. Usually we leave this on all. We also can say I need to look for a patient's information. Say I need to look, and down here is where I can, for example, search for a patient's result. I've pulled up his result. I can hover over to see it. I can print it. I can also edit it. This is some of the basics for starting in the clinic, and feel free to jump in and we'll help you as much as we can.